Hello, everyone. As we all maintain social distancing, right? I thought of doing a different version of the lightning chat, right? Maybe just talk to you guys, right? My name is Dilip Advani, and I lead the marketing team here at Uila. And today's topic that I want to talk about is around monitoring healthcare IT environments, right? Whether they're running in the data center or they're running in the cloud, right? So, healthcare organizations, as all of you know, right, are seeing an explosion in the amount of health data that's being generated, right? But the IT teams, right, guys like you, right, guys and gals like you, supporting those organizations, get overwhelmed supporting the sheer amount of data, right? And add to that the HIPAA compliance regulations, the tight budgets that everyone's faced in the past, and it's going to get worse as we move along, and security concerns. And the job for all the IT teams are getting tougher, right? And if you look at an outage, right, especially an unplanned outage, right, uh, as per industry research, right, when you look at healthcare organizations, they cost anywhere between $9,000 to $16,000 per minute. And if you look at the complete incident, the average cost of that incident could be uh, ranging in the amount of $700 to $800,000, right? So, but these outages, right, they have a significant impact on your organization, right? So the outages obviously lead to lower productivity levels for the physicians and the clinical staff. And in many situations, the overall patient care could get compromised, right? So improving that patient care, right, which obviously depends on the patient experience, is of utmost importance for any healthcare organization, right? So this includes both supporting the medical applications used by the or accessed by the medical staff, right, to provide that patient care, as well as application on network access for the patient or for any of their guests, right? So anything that does not compromise or does not impact your HCAP score for patient satisfaction is super critical, right? So also when you look at a healthcare setup, right? So there are many mission critical applications, right, that you will care about, right? But none are more important than your EMR or EHR, right? The electronic medical records, right? There's the HL7 protocol, there's the imaging standards around DICOM, right? Then there are unique applications, right? The fun stuff from the olden days, right? The pneumatic tubes, right? That are used to send lab samples all over the hospitals, right? Making sure, right, these applications are working at the maximized performance level is what every IT organization strives for, right? And if you look beyond some of those applications, right, there's also VDI, right? Once again, could be used by the physicians where maybe they want a consistent desktop experience as they visit different patients, right? Or for, right, they could be using it for medication orders, entering allergy information, accessing historical data, right? Or it could be used by the patients or their visiting guests as well, right? So that desktop VDI type of environment also needs to be available, needs to be reliable, and then obviously super fast during your login and just normal usage as well, right? So there are a few common scenarios that that occur in the healthcare environment, right? That's critical for monitoring, right? Typically, when a problem occurs, right, you have these silo groups, right? So you could have your networking people, you can have your application DevOps people, you have your infrastructure people, you have stuff in the cloud, you could have cloud operations, you have your security guys, right? Everybody's getting together and they're trying to solve the problem, right? But often they're focused, or you can even say distracted to some extent by the symptoms instead of looking or trying to find the root cause of the issue, right? Because all of them may have a single dimension visibility into the deployment, right? Infrastructure guys using an infrastructure monitor tool, they're focused on that. Application guys, maybe they're using an APM tool, looking at that. Networking guys using a network tool, right? So there's no overall multi-dimensional or full stack visibility into the deployment. So you really don't know where the issue lies, right? So this is what I believe healthcare IT teams really need to change, right? They need to look at the problem from the perspective of the user, right? And then look at the full stack, right? Look at network, both virtual and physical side. look at the infrastructure in terms of compute and storage, and then look at the application itself, right? Whether it's any of those applications that I mentioned earlier, right? Or it's any other application, right? Uh, Once you have the full stack visibility, right, you will know what the reason is behind your EMR application slowing down or not working, right? Also, healthcare environments, right, you guys suffer from the environments being very complex and it's dynamic and there are changes occurring constantly, right? So being on top of what exists in the environment, right, tracking changes, and then even pinpointing quickly where the issue lies, right? This is what you need, right? And you can actually do that if you have an application or infrastructure dependency mapping solution, right? And if that solution's agentless, which makes rollout simple and more universal, that's perfect, right? And if it's automated, where those dependency maps are being built end to end automatically and has an application centric view where it's classifying applications like the healthcare applications I mentioned before, that's what's going to make the lives of you guys, right? Make it simple, right? So that you can respond to issues faster and proactively avoid many of those unplanned downtimes, right? So those are some of the things, right? Like I mentioned, right? Being able to see the full stack, being able to have that end-to-end visibility of your entire deployment and say, this is where the issue lies and the root cause is because of the of storage. Don't bother the networking guy, don't bother the infrastructure person, right? Being able to get to that root cause, right, easily is I think very critical to you guys, right? So that's all I wanted to talk about today, right? Thank you and have a great day. We'll talk again in another lightning chat. Thank you.